The role of mental health support in addiction recovery. By Dennis Relojo-Howell. Addiction is a complex condition that intertwines physical dependence with profound psychological and emotional underpinnings. Traditional approaches to addiction recovery often focus solely on the physical aspect of dependency. However, modern strategies emphasize the critical role of mental health support in facilitating a more comprehensive and sustainable recovery. Understanding the interplay between mental health and addiction. Addiction always comes with something that helps to get addicted, but addiction does not exist in isolation. It carries with it mental health ailments such as clinical depression, anxiety, or post-traumatic stress disorder, PTSD, which typically resurface alongside it. Such interaction is multifaceted and, therefore, is a source of concern, especially for the theories of drug addiction treatment. The mental health disorders begin to gather strength and ease recovery chances, which makes relapse likely when not treated. Mental health problems can be the initial thing to be done with drugs to cope, which only makes matters worse for the person with the mental illness and the addiction. So, such a situation now causes the most complex programming of overall treatment, which includes mental health support as a crucial element to accompany it. The multi-level involvement of mental health treatment in addiction recovery requires a range of intervention techniques and measures aimed at reducing mental health symptoms as well as changing addictive behavior. Therapies that employ cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and motivational interviewing are the most common ways of helping people resist undesirable behavior patterns and regulate their emotional responses. They are, therefore, vital since they empower people with the strategies required for them to deal with mental health problems, challenging life events, and temptations of substance abuse. The positive aspects of complementary rehabilitation plans. Integrated treatment programs that include mental health services offer not just several advantages but also essential care for those who are mentally challenged. In this regard, they recognize that the addiction itself is usually just a symptom of a series of problems in an individual's life, namely the highly personal needs that the person with addiction may have. This way, it reflects that mental health is a fundamental aspect of physical health, and not only should survivors be equally strong, but the treatment should also be double strength. These programs, by nature, tackle the problem of substance abuse from the perspective of treating the person as a whole. As a result, they improve their effectiveness in achieving successful recovery and long-term sobriety. Secondly, integrated programs give clients a smooth treatment experience and holistic intervention by multidisciplinary personnel rather than a single therapist throughout the care process. A variety of therapists, psychologists, psychiatrists, and other counselors on such teams have to create personalized treatment depending on the case. This cooperative approach leads to the fact that all the factors that are causing addiction are being removed from the basics, and as a result, the risk of relapsing is reduced. Besides, these periodical programs provide a future outlook, helping the individuals even after the initial treatment period. Such services may include daytime therapy, patient group meetings, and other beneficial resources for comprehensive support and assistance to clients in remaining mentally stable and reacting to the arising difficulties. Another factor that is needed is the continuous availability of this support every moment that people go through this life after their recovery, as they need to be equipped with tools that could assist them in getting through the pressure that may have initially caused drug abuse. Takeaway: the mental health support that is available in the process of addiction recovery may be considered crucial. As we aim to continuously improve the effect of addiction treatment, going beyond the traditional lines will be essential, and the creation of a more sophisticated strategy that is integrated and holistic will be necessary. Places like Insight Northwest Recovery are stepping forward, showing the way for crucial work in this field, and becoming the beacon of hope and healing for those fighting the dual battles of mental health disorders and substance addiction. By giving top priority to mental health as a mainstay of effective and efficient addiction recovery, we not only facilitate success but also enhance our wider health and wellness agenda for people with addiction.